We begin a two-part series today based on the compelling new book, Every Patient Tells a Story, Medical Mysteries and the Art of Diagnosis by Dr. Lisa Sanders. The TV series House is based on her career, and she writes the diagnosis column for the New York Times Magazine. Before we meet Dr. Sanders, take a look at one of her incredible stories.
Amanda BOLSTRIDGE works 80-hour weeks during harvest time at a broccoli farm in northern Maine.
This is one of your nurses, Lori.
You'd never know, just 2 years ago, she was near death.
She kept saying, "There's something wrong. My head feels funny. There's something wrong in my head."
Amanda was having terrible migraines and mood swings so violent, her mother had to take her to the emergency room. After being sent to hospital after hospital, Amanda was diagnosed with encephalitis, a swelling of her brain.
I believe it was around the 11th of August is the last day that I remember anything.
Amanda had gone into a coma. Her mother was afraid she was slipping away.
Just thinking about it, I want to cry. Because we came so close.
It's not something a mother should have to watch her child go through.
Amanda was transferred to the Neurology Intensive Care Unit at world-renowned Massachusetts General Hospital. First-year OB-GYN resident Rachel Clark got a page.
She was a mystery, like nothing exactly pointed to anything until they had this scan.
This CAT scan revealed a small cyst on Amanda's left ovary. Dr. Clark showed the results to attending OB-GYN, Dr. Rebecca Culp.
Here's her left ovary, and here's the little cyst filled with the different types of tissue within that ovary.
Dr. Culp diagnosed Amanda's cyst as a teratoma. Teratomas can form virtually any tissue or organ in the body, often growing teeth and hair. But was there a connection between this cyst and the swelling in Amanda's brain?
We think we know everything in medicine, and we think we've figured so many things out, and yet there's still a lot of mysteries out there.
In Amanda's case, doctors believed her teratoma might actually be making brain cells, which her immune system recognized as foreign. Could the antibodies in Amanda's system be attacking not only the growing brain cells in her cyst, but also her brain? Dr. Clark recommended the cyst be removed.
I was kind of embarrassed, actually, to bring it up to the team because I was like, oh my God, I'm a new intern and they're going to think I'm insane that I want to take this girl to the OR.
Dr. Culp agreed surgery was the only option. Her left ovary was removed that day.
The odds I was right were terrible.
The next morning, Amanda was still in a coma. Dr. Clark was disappointed until Dr. Culp gave her a call.
And she was like, Rachel, you're not going to believe this. You need to get up here now.
When I walked in, she was sitting on the edge of the bed, one leg over the railing, and she was going home.
After 2 months in a coma, Amanda was back.
Thank you for giving me my daughter.
It was really one of the greatest moments of my career because it's really like bringing somebody back, and something I never, ever would have dreamed that I would have been involved in.
Yeah, it was a cool day.
And now Dr. Lisa Sanders, who wrote about Amanda's case for the New York Times Magazine, joins us this morning. Good morning to you.
Good morning. How are you?
So many great lessons in there. Listen to all the opinions, weigh all the options, because you never know.
You never know. You know, when I went to medical school, my very first day on medical school, the dean said to all of us, said 50% of what we're going to teach you in the next 4 years is wrong. Unfortunately, we don't know which half. It's because we don't know it yet. So things, the doctor is right. Mysteries are happening all the time. We think that medicine is this set body of knowledge, but we're adding to it all the time. New diseases, new treatments.
And you talk about fascinating cases like that, so many of them in your new book, Every Patient Tells a Story. Is this book supposed to be sort of a reminder to the medical community to listen to the patient's story?
To the medical community to listen, and to the patients to speak. I think that patients are afraid to tell their stories. Doctors don't give them any indication that their story is important, and yet it's clear that up to 80%, sometimes 90% of cases are diagnosed based on the patient's history, the story they have to tell and what's happened to them before. So it's very important that people tell their story.
So that's what you would recommend. That's how we can be our best advocate, is to tell every detail that we can remember about our story.
Tell the story that you've been telling it to your wife, your husband, your friends, your mother, your daughter. Tell that story because in it is important information.
So fascinating how you even came to be a doctor. Lisa was a producer for our program, and then later than most people, you had a career change, became this doctor, became the inspiration for the TV show House. Congratulations, Lisa.
Oh, thank you so much.
It's a pleasure having you here.
Thank you.